Welcome to the weekly dose of self-care presented by your neighborhood pharmacist. Today, we're going to talk about anemia in just 5 minutes. Normally, red blood cells in our body supply nutrients and oxygen to our body wherever it is needed. But when you have anemia, it's either you don't have enough red blood cells or that you have not healthy red blood cells, so it's not able to do its job properly. Anemia could be caused by multiple things, such as low iron, low folate, low B12, or many others. Today, we're going to focus on how to treat low iron anemia. Symptoms of anemia may include feeling more tired than usual, maybe loss of appetite, or problems with concentrating or sinking. Having those symptoms alone is not enough for a diagnosis. It is very important to go for some blood work to see which one you're actually low on. As mentioned, you could be low on folic acid, or vitamin B12, or iron, or other things. So if you take the wrong supplement, such as that you take folic acid but you're actually low on vitamin B12, then what will happen is that you're masking the B12 that you're low on, and you may get some improvement in some symptoms, but not everything will disappear because you're giving yourself the wrong thing. When you're choosing an iron product, the packaging might be a little confusing, such as this Eurofor for example. It says 300 mg, but you're actually not using all 300 mg. When we talk about iron supplements, you gotta pay attention to the elemental iron. So if you were to flip this bottle to the back side, you will actually see now it says ferrous fumarate 300 mg, but it says the elemental iron is only 100 mg. And that 100 mg is what our body can absorb and what our body can use. So that part is very important. There are many commercial products out there for iron supplements, but there is no such thing as a side effects-free iron. It depends on the elemental iron content in there. The lower it is, there's less chance of having side effects. The first product we're going to talk about is fluoridated iron tablets. It has an ingredient of ferrous gluconate and it has the lowest elemental iron of all the ones we're going to be talking about. It has 10 mg only, but it also has other vitamin B as part of the tablet. But the concern is, since the elemental iron component is just so low, it will cost a lot for you to get the dose that you need. Because typically, the recommended elemental iron per day is between 100 mg to 200 mg. But obviously that depends on your blood work and what the doctor recommends as well. The next one is Ferromat powder. So this one has 15 mg of elemental iron, and this is usually good for kids who need iron supplements. Now there's one unique thing about Ferromats because it's called polysaccharide iron complex. This one is more special because it is modified so that it has less potential for side effects, but still ensuring that you get enough elemental iron that you need. But because it is modified, usually it's a little more pricey compared to other irons. Now moving up the ladder, there is the ferrous gluconate at 28 mg per elemental iron, then ferrous sulfate at 60 mg, then ferrous fumarate at 100 mg. So there's Eurofer as well as Palafor for the ferrous fumarate part. The last one is the Ferromats that's usually used for adults. It gives these 150 mg of elemental iron. So out of all these ones, it also depends on how low your iron is, but usually a good one to choose from is Ferromat because it has a balance between the side effects as well as the elemental iron, but it might be a little bit on the pricier end. But if you're looking for something more affordable and it also gives enough of elemental iron, then Eurofor usually is a good one because it's probably less than $10 and you also get 100 mg of elemental iron. Iron supplements are best taken on an empty stomach, but when people do that, there's a higher chance of having side effects. So if the side effects do happen and it bothers you, then you can take it with a full stomach. Other ways of increasing the absorption of iron supplements is by taking it with vitamin C. So this would be with a glass of orange juice, or you can take 100 mg of vitamin C. But it's very important to space any milk or tea away from iron supplements by at least 2 hours, just so the absorption is not affected. Some common side effects of iron include just having some nausea, upset stomach, darker stools, and constipation. For the nausea part, it can be managed by taking it with some food, or just taking the medication before bedtime, so you sleep through the side effects instead. Unless you're vegetarian or you're not able to get enough iron from the diet source, then these supplements are generally not recommended for lifelong. It's very important to go do some follow-up blood work to see if the iron level is at the level that it should be now. So typically 3 months after you reach the target, you can just stop the iron supplement. So make sure you do follow up with the doctor. If you have any feedback or comment about the channel, please comment below. Otherwise, please like and subscribe and turn on notification. And I'll see you next Saturday at 8 p.m. Bye!